Hi, everybody. We'll get started here in a minute or so. Okay, I see it's 2 minutes after, so let's go ahead and get started. Thank you, everyone, for joining us today. I'm Jenny Schitter. I'm the Director of Public Health Data at the Big Cities Health Coalition. BCHC is a forum for the leaders of America's largest metropolitan health departments to exchange strategies and jointly address issues to promote and protect the health and safety of more than 61 million people they serve. Together, these health departments directly affect the health and well-being of about 1 in 5 Americans. Here you can see all the list of 35 member jurisdictions. BCHC focuses its advocacy on several core issues. One of them is the need to prioritize public health data modernization. We need more local data, not just at the county level, but at the city level as well. Tracking trends at this level helps inform policy decisions and can identify those that are working or some that might not be. CDC has expanded its investment into data modernization at the state level and to some extent the local level as well. We urge this continued commitment through dedicated congressional funding and CDC engagement. So we've been doing our part to improve access to local health data by creating the platform you'll tour today. 3 decades ago, a group of big city epidemiologists created the Big City Health Inventory, or BCHI. They published chart books on a semi-regular basis to share information with their peers in other jurisdictions so they could benchmark health indicators. In 2015, BCHC relaunched the project as an online platform with funding from CDC. And finally, in 2019, we partnered with the Urban Health Collaborative at Drexel University's Dornsife School of Public Health. The Urban Health Collaborative was created to leverage the power of data, research, education, and partnerships in order to make cities healthier, more equitable, and environmentally sustainable. So the team at Drexel you hear from today, their job is to manage that day-to-day work and the upkeep of the platform, and they've been doing so for the last several years. So shortly, we'll discuss the new features on BCHI. So you can follow along with us. Just join, go to bigcitieshealthdata.org, and Elizabeth will drop that in the chat so you guys can follow along. But before we dive in, I do want to share that the platform is primarily supported by CDC through a cooperative agreement with the National Association of County and City Health Officials, or NACCHO. And our BCHC staff time is supported by a number of health philanthropies from whom we have ongoing grants. So the views expressed here do not necessarily reflect the views of CDC, NACCHO, or BCHC's funders. So with that, let's jump in. If questions arise during our conversation, please feel free to place them in the Q&A feature, and we'll answer them later in the webinar. But right now, I'd like to introduce Dr. Amy Auchincloss from Drexel Urban Health Collaborative, and from there, she'll pass the baton to the rest of her team as we tour the platform. So Amy, passing it to you.
Amy, you need to unmute yourself.
Thank you, Jenny. Thank you to everyone who's joining us today. We appreciate your time. My name is Amy Auchincloss. I'm an associate professor of epidemiology here at Drexel, at the Dornsife School of Public Health, and I'm at the Urban Health Collaborative. So the Urban Health Collaborative leads and supports a number of projects that focus on urban health in cities across the nation and across the globe. Much of our work does focus on health inequities, and you can find out more about us at this URL. I'm joined here today with my colleague Saima Niamatullah, who you'll hear from shortly. And I wanted to thank all the big city member cities, 35 of them, whose data is on the platform. We are largely sourcing the data at this point from federal data sources, but in the old days, these cities were actually providing data directly to the Big Cities Health Coalition for the platform. So we really appreciate that. We were trying to get a little bit of a sense of how much you've used the platform before in order to figure out how quickly we should go. So if anyone can, if you guys see this poll up on the screen, if you don't see it, let us know. But hopefully you can click in, just let us know what you're. I don't see any answers come in, but hopefully it's hopefully you're filling that out. So I'm going to provide a quick overview of what's on the platform before we get started with the demo. So the platform currently has over 120 metrics with over 150,000 data points. They're grouped into these 11 categories shown on the screen. Great. I don't know if you guys can see this, but I see the majority have not visited the platform in the past 12 months. Another 30% have 1 to 3 visits, and then a small number have used the platform more. So good. This is good information. Thank you. Metrics were chosen for this platform because of their public health relevance. Mostly they're aligning with CDC's Healthy People goals, their benchmarks for new policy initiatives, and many of the metrics are able to highlight demographic and socioeconomic disparities in health and healthy environments. About 1/2 of the metrics that are currently on the platform were prioritized in BCHC's prior versions of the platform. So unique features of our platform, the majority of data are city level, and they are the 35 member cities of the BCHC. We don't have data that is a smaller geography than city. Data are uniform and standardized across cities to allow for comparability, primarily sourced from government agencies, and we update annually as data are released. So currently the platform includes 2010 through 2022. So this month we finished adding 2022 for most of the platform metrics. That includes the natality files, the mortality files, and 70 other metrics, including the new census data for 2018-2022, which is a request from last year's webinar that some of you might have joined. We've recently added 4 new metrics to the platform that are focused on climate. 2 on heat waves, the number of heat waves, longer heat wave season, longer summer essentially, and 2 on disasters, climate related disasters and community social vulnerability to disasters. The data for these, the climate-related metrics are sourced from EPA, from NOAA, and from FEMA, and also from the CDC ATSGR's geospatial research that compiled the SOVI, or the Social Vulnerability Index, that many of you are using already. I added here also air quality, which is not a new metric. We've had that on the platform for a year or so. Those are air quality indexes from the EPA. Just to note that the heat wave metrics were calculated following definitions and methodology that were developed by EPA and NOAA. We largely were replicating what they had already defined. We have another poll actually putting up just to get a little bit of your feedback on whether the climate metrics are things that you would want to see more of, or at least would want the current list on the platform, are happy to see it or not. And also how you could envision utilizing those data if you do want them there, I guess. So the findings from the metrics that we have on the platform are that there are more heat waves in the BCHC cities. So currently 5 heat waves per year, whereas decades ago there were only 1 or 2 heat waves per year. Longer summers in the BCHC cities and across the US probably, as duration of the warm season has lengthened by 35 days compared to decades ago, and longer duration of disasters. So currently the cities are subject to about 1 climate-related disaster every 2 years, lasting a total of almost 30 days, whereas decades ago, every 2 years, the disasters were only lasting about 8 days. This is a graphic by the Medical Society Consortium that's showing the wide range of health effects that are occurring due to the climate emergency, from wildfires, extreme temperatures, all the way to more mosquito-borne and tick-borne diseases. We've seen a lot of wildfire, air pollution degradation, or air pollution quality has been highly impacted by some of the wildfires. Just even Kansas City, I think even just this past week, the wildfires coming from Canada. So the impact of the climate emergency is felt everywhere, although there are regional variations in some of the actual risk factors. So are climate data useful? So this is a big question for us to get your feedback on, and how would documenting current climate conditions and changes in climate motivate efforts to prepare and prevent for climate-related health effects? And how might you be using the data in the future? So good. I'm not sure if you can see it, but we're seeing about 67% agree that they like the climate data on the platform, 20% somewhat agree, and 14% have no opinion or don't have enough information. And great, we have some responses, although we can't see them yet until after the webinar, on how folks might be using the data. Thank you so much for your feedback. We appreciate it. We have a poll at the end, but I think that's it for the polling for a couple of minutes. Before turning it over to my colleague Saima and Niamatullah, I wanted to just draw your attention to some data summaries we have on our What's New page, and Saima will point out where you can find these. We recently completed data summary on people experiencing homelessness in the big cities, and also on very stark racial disparities in vaccine intake and flu-related deaths, as well as in the last summer, we did a brief and some infographics on gun deaths in big cities. So I will turn this over to Saima Niamatullah to take us through the demonstration.
Thank you, Amy. Thank you, everyone, for joining us. I'm Saima Niamatullah, and I'm responsible for the data management and analysis in our website. Today, I'll walk you through some of the useful functions that are available in our website. The web link should be in the chat. It is bigcitieshealthdata.org. So before I start, I want to just give you an introduction to the metric that I will be using today for my demonstration. It's going to be life expectancy at birth. It's expressed in years and calculated as 2-year estimates. The BCHC team calculated the life expectancy at birth from the vital statistics data from the CDC, National Center of Health Statistics, and these were calculated at the city level. For those of you who have used our platform before, we have made some improvements to this life expectancy metric, where right now we calculate it as 2-year estimates, which help us better visualize the changes over time. So these are some of the examples of the things you can visualize or use our platform. For example, you can use the platform to view a metric for one single city and just suppose with other associated factors. Example 2 is use the data to visualize, compare between different BCHC cities. And example 3, we visualize the race and ethnic inequities between ethnic inequities in the metric. So the web link should land you to the home page. There are multiple ways you can start exploring the city data. Explore the city data. So you can click on these big boxes, which would like the explore a big city, compare cities, or racial inequities, which will take you to these features. You can also click on your city in the map, which will take you to your city data directly. In the top navigation bar, we have the main options available for users. Those are explore a big city, compare cities, view a metric, or the inequities. So in order to view multiple metrics for a single city, I will go to the explore a big city page. These are the 35 BCHC cities for which we have data in our platform. I will choose Chicago. This is the city page for Chicago. On the top right corner, we have a small description of the demographics of the city. This page should pre-populate with metrics, which kind of gives an users of the examples of the type of data we have. But you can dismiss them and select the metric of your choice. As you can see, we have over 120 metrics in the platform. You can click on this pop-out icon at the corner, which gives all the metrics in categorized list. These are the 11 categories in which the metrics are divided in our platform. And you can refer to our technical documentation for more details about the metrics and the classification into categories and subcategories. For life expectancy, I'll go to life expectancy and death and choose life expectancy. This is the life expectancy trends in life expectancy. And the x-axis are the years. As you can see, the data start from 2011 to 2022. If you hover over the points, you get an exact value for the different years. In our platform, we have demographic details for most of the metrics. You can access that by clicking on this group by. So we have data for population subgroups, like by race or sex, and race and sex. In case the data are not available for any population breakdown, that option will be grayed out. I'll choose race. So these are the trends in life expectancy for Chicago by race. So on the bottom, you see we have data for the race groups Hispanic, non-Hispanic white, Blacks, and Asian and Pacific Islanders. Most of the metrics in our platform have, these are the main racial categories for which we have data in our platform. You can also add more metrics by clicking on the Add Metric button. For example, if you're interested in, intrigued by the dip in life expectancy post-2019 and want to check out the COVID-19 values, the metric bar is also, this bar is also searchable. So you can start typing in keywords and all the relevant metrics will come up. For example, in our platform, we have data on COVID-19 deaths and COVID-19 vaccination rates for adults and seniors. I'll choose the COVID-19 deaths. So this is the bar chart. This is a time trend for COVID-19 deaths in Chicago. And of course, it starts from 2020 and we have the data until 2022. You can also view the data for a single year by selecting the years. So this is the COVID-19 deaths in Chicago, and the different bars represent the different races. If you think this chart is too crowded and would like to dismiss any of the bars, you can click on the label for the bar to get rid of it, to visualize, to get a visual that's to your preference. So this was viewing multiple metrics for a single city. In our example 2, we have the comparing the data for different BCHC cities. In order to compare the data, we can go to the compare cities. To compare cities, first we have to select a city. I'll choose Chicago as the primary city. For comparison, cities for comparison, you can choose the city in multiple ways. If you know the city you want to compare your city data to, you can select it from the list, and you can select up to 6 cities. For those of you who are not sure of which city you want to select, compare your city to, you can also select the 5 comparison cities feature, which lists 5 pre-selected cities which are similar to the primary city based on certain socio-demographic criteria. And you can find more details about the criteria for selection in our technical documentation, which I'll show you in a while. The third option available to users is choosing all cities. This allows users to view the data for all BCHC cities in a single chart. The step 2 is selecting metric. I'll select life expectancy. This is a chart for life expectancy in all BCHC cities in 2022. On the y-axis are the cities. We also have a vertical US total reference line, which gives the national average. You can add some useful features to this chart. For example, use the sort by to sort the data from high to low. To put the cities into context, you can also divide the cities, group cities by certain city characteristics in the top box here. The characteristics available are region, poverty, population, density, and segregation. I'll choose poverty. So this shows all the BCHC cities grouped based on poverty. For example, the poorest cities are at the bottom and the less poor cities are at the top. And from a cursory view, you can see the poorest cities tend to have lower life expectancy compared to the less poor cities. In this page as well, you can add multiple metrics by hitting the Add Metric button. And there is no limit to the number of metrics you can add to any page. You can also compare cities by breaking down the data by race and by other population subgroups by hitting on by group by. But this option is available only if less than 7 cities are selected. You can also view the time trends for different cities, but also if only less than 7 cities are selected. So in the next page, I have actually selected 6 cities and some metrics. So if I select group by race, here we can see the life expectancy for all the cities broken down by their race groups. And in the next panel, I have poverty level, percent of population living below poverty. I can also change the years to all years to see the changing trends in poverty level in these cities. So each line represents a city in this chart. And like before, if you think it's too crowded, you can click on the label for the city to dismiss it to have a better view. So in our third example, so this was comparing the data for different BCHC cities. We also have other options, which I hope you will explore it on your own. And the third example is viewing the differences by race and ethnicity. So as you have seen before in our Explore a Big City and Compare Cities page, we can group cities by race. So we get a view of the racial differences in either a single city or compare across multiple cities. We also have an additional features in the inequities page where you can view the absolute difference in rates between the different races. So in the inequities, all the metrics available are, you can view the difference in race for the metrics available by race. So first we choose a metric. We have the option to choose all cities or a single city. In this chart, the central axis is at 0. A value of 0 means there is no difference in the rate between the minority population and the white population. Each bar represents the absolute difference in rate between the minority population and the white population. For example, the black-white difference is the difference in life expectancy between black minus white. The green bar represents between Hispanic minus white, and the red bar represents the Asian minus white. If you hover over the bar, you can have a small text explaining the value. For example, compared to white person, black person have 12.9 less life expectancy years. Difference is black 68.9 minus white 81.9. You can also view the data for all comparison for all cities, in which case all the racial differences are separated out in the separate charts. The first chart shows the black-white difference in life expectancy. On the y-axis are the cities, and the central axis is at 0. For blacks, you see most of the bars have a negative value or are pointed towards the left, which implies that life expectancy for most cities for blacks are lower than whites. Similarly, on the Hispanic-white difference, you can view the Hispanic-white difference for all cities. And at the bottom here, we have the Asian-white difference. This was viewing inequities for the different cities. We have another feature, which is viewable metric, where you can view a single metric in multiple ways, but I will not get into it today because of the interest of time. Lastly, I want to discuss about how users can use the data in our platform. So every chart has a hamburger at the right top corner. If you click on it, you can download the image file for the chart. We are also adding a new feature where you can download the data for the chart as an Excel file. This feature will be added shortly, maybe within the next month or so. You can also use the share icon to share the link to the page that you create. And all the data in our platform can be downloaded as an Excel spreadsheet. The link to the download page is here below. As you can see, you have to fill out this form, but this form has only the email field is required. And all the data are available for download for free and does not require any special permission. The technical documentation is here. And I would highly encourage anyone downloading the data to review our technical documentation to better understand all the metrics, the definitions and calculations, and the link to the codebook, which will help you better understand our data. And finally, as Amy showed, the What's New page is up here, which links to all the different reports and infographics that are published by our platform. Please subscribe to our platform to stay up to date on all the different new updates and the metrics that are the features that are coming, that are going to be released, that are being released. You also have the FAQ, which has some frequently asked questions like how to cite the platform and also links to the documentation. And if you have any questions or suggestions, please submit them in our web form. We always love to hear from users about any new metric or new feature that they want to see in the platform. And please leave a comment. And you can leave your email address if you want to hear back from us or not, and everything else is optional. So thank you for your time, and I'll pass it back to you, Amy.
Thank you so much. That was awesome, Saima. Thanks so much. So Jenny may have leading the question, the Q&A. Thank you for your contributions to the Q&A section. We also have a few questions that came in during the registration that we can also address.
Yeah, so let me Let me go ahead and kind of move through some of the questions that we've gotten both through the registration process and the chat. And if you, while we're doing this, if you think of any additional questions that you'd like to ask, please use the Q&A feature rather than the chat to post your questions. So if you go to the bottom of your screen, the middle button is a Q&A button, and you can just post your question there. So one of the questions
I also wanted to let you know, just highlight that there is a pop-up poll on the screen that is asking for any feedback that you have. We have had such a very difficult time getting feedback. There's a pop-up survey that shows up when people go onto the site, but as many of you know, the kind of response rate for that is tiny. So we're taking advantage of you all being here to get some feedback. So thank you.
active audience. And actually, on that note, one person did mention in the Q&A that blackouts would be a metric that they would like to see on the platform in the future. So another question that we got in the chat was asking about what is the software that you're running in the background that is sort of populating the charts and graphs that are on the site.
Simon, I don't know if you want to take that.
So it's the website is designed in Django, and I believe they use high charts for creating the graphs.
Yeah, we didn't. This was developed. We didn't do the web development for this. We collaborated with the group called Lincoln Loop, who we highly recommend. Shout out to Lincoln Loop. They've been terrific. They've done a really great job for us, and we're in another contract period right now, working on things like that Simon actually already mentioned. But your suggestions on any website improvements is also good timing, because we are in a web development phase right now.
Another question that we got from the registration process actually was asking about, and this is something that I know we're often asked, but is probably worth talking about again in this setting, is whether there's any data available at kind of smaller geographic areas like neighborhoods or zip code tracks or that sort of thing. And if not, why that isn't available on the platform.
Yeah, I can answer that. It's no, we do not have any sub-city geography. Our platform is really focused on summarizing data for the big cities in the city entity. And there's a few metrics that are county level, but for the most part, our data are city. We don't have neighborhood data. There isn't a lot of neighborhood data available, except for, well, of course, there's census data available, but yeah, the point of our platform was a more breadth in the kind of metrics that we could have, and also standardized across all sites. And we didn't focus on neighborhood data. But we do recognize that many cities want sub-city information. So yeah, this platform doesn't fulfill that goal.
Let's see. Another question that we've gotten from the registration is how the race and ethnicity groups were chosen, and I know, Saima, you said a little bit about that during your presentation, but if you wouldn't mind elaborating on that a little more.
So the race ethnicity groups that were selected were based on the data available from the source data. So we had a number of limitations because calculation we need the race ethnicity subgroups that are present in the data versus the data for the population. So we had to align those and kind of come up with a set list. And so we were limited to just the non-Hispanic whites, Hispanic, Black, and Asian Pacific Islanders for most of the metrics. And our data was not did not allow us to break down any of the minority groups into subgroups, because, like as I said, the lack of data, or we also have a censoring criteria which limits how much how many the incidents for which we can publish the data, and below a certain level, we can't publish those data. So because of the cities, and if we broken down to smaller groups, we did not meet the censoring criteria. So we had to give up on trying to publish data for small subgroups.
I would just add that for a limited number of metrics, there is some detail on American Indian and Alaska Native, particularly the census data. We have some detail on that. And also in the teen health data, the data that's sourced from the YRBS. More detail is available in the technical documentation.
So we've gotten a couple of questions in the chat that actually I think I'll sort of take on, since they're more about why why it was decided to, it was these cities and why not rural areas. So one person asked in the Q&A, has the team gotten requests or have had conversations internally about providing data metrics for rural communities? And then Becky asked, is the set of characteristics, there's another, well, there was a question, I think it disappeared, about, why, how were these cities chosen?
Yeah.
So just to explain, because we're the Big Cities Health Coalition, we have focused the data on our 35 member cities, which are 35 of the largest cities in the United States. And so we haven't discussed posting rural data, although obviously we believe there's value in having these kinds of data sets. It's just not our purview. But I would suggest, having worked in a state health department that worked with both rural and urban communities, the county health rankings site is an excellent source for that data. And there are a number of other sites that do provide really excellent granular data at the county level for both urban and rural areas. Becky O'Meara asks, is the set of characteristics used to determine like cities for comparison available to be shared? So, how are those, that feature that you showed Saima earlier, where, you can get
the comparison
comparable cities. How did you determine that?
So I can answer this. So it was based, it's in the technical documentation, our details in the technical documentation PDF, our details. Briefly, we used population demographics such as population size, poverty, race and ethnicity. Death index was the only health index that we were incorporated, and region. And for some of the members who actually asked, well, this was a feature that was requested by some members. So they had input as to whether it aligned with what some of their expectations were. But we would welcome feedback from more members actually on this, or anyone else that wants to contribute, since we haven't gotten much feedback on whether the grouping that we did aligned with their expectations for their city. There is the caveat, as Elizabeth has already mentioned, that the universe of cities is limited to the 35 member cities. It's not all cities. So.
Thank you. You've also gotten some feedback for in terms of metrics that people would like to see. Juan Carlos Reynoso recommends safety net organizations and food pantries as 2 more metrics that would be useful. Certainly something we can discuss. and have to figure out where to get that information from, but I like the idea.
Yeah. I guess I could answer. Some of the questions that we get are around how are new indicators selected. So new indicator ideas for new metrics originate with us and with you all, and with the BCHC and the members themselves. So we go through a process of determining interest among BCHC members, as well as feasibility. And the feasibility end includes identifying a standardized data source across our cities, coverage of our cities, and also meaning all 35, and data quality. So after we kind of take that journey, then we bring some of the ideas to the BCHC leadership group and the data advisory group that's made up of some members to see whether they think the metric is a priority. So we have several, or we may have several of our data advisory panel members on the call today. Thank you for their work in helping us with this.
Thank you. Sorry, I'm trying to answer questions in the Q&A while I'm should probably not be doing two things at once. For those who have used the city health dashboard, one person was asking about how this is comparable to that and what might be sort of unique about this data dashboard.
Yeah, so the unique feature for ours is the number of metrics. The breadth of metrics is about twice at least of the metrics that are in the City Health Dashboard. But we have far fewer cities, as you can already tell. So there's 35 versus hundreds that are in the City Health Dashboard. Our platform features updated data, the ability to look at trends over time, and stratification by race, ethnicity, and it's focused on city level data. So we don't have neighborhood track data. Those data are available for some metrics in the City Health Dashboard.
Thank you. I believe that is the last question. I'm seeing a request for the link again. So let me just get that to you real quick here in the chat.
We often get questions about, well, how is the data used? How are cities using it? How are others using it? Since the platform was launched, we've had about 50,000 page views, around 15,000 users of the platform. We'd love to hear your stories about how you're using it. We've been using data internally to help support BCHC's public health advocacy and member needs. For example, the lowering gun deaths and addressing drug overdoses are two priority areas for BCHC that we've then created data briefs and summaries using the platform data. Universities are using it for teaching purposes, and we do have some county and city public health staff that tell us some uses that they've had for the data. But more of that would really be appreciated because it helps us provide ideas to others as to how they may be able to use the data and make it more real, really transferring some of the information that we have into real life needs that you all have.
Yeah, and I know we've heard from some of our members too that for people working in these cities, having the ability to do the comparison across cities can be helpful, kind of no matter where you are on that scale, right? So, if you have a particularly high life expectancy rate, or another kind of positive health indicator, that can be a great measure to see. And also, if you're at the very bottom of that scale, it's a good indicator. It's a useful tool in order to advocate for more resources from your local government to address that issue. Okay, well, I think unless we have, oh, sorry, I see one more question here in the Q&A from Mickey. Are there plans to have sex and gender differences shown much like the race ethnicity differences shown in the inequities area?
Yeah, thanks, Mickey, for that question. Yeah, there's some really interesting differences there as well. We have a little bit of a hard time sort of not overwhelming. We think many of our features on the platform are actually underutilized, and that tab being one of them, the inequities, and don't want to try to overwhelm too much the reader. So yeah, any ideas, or we maybe could have an offline conversation with anyone that's interested in that per se. Those data can be calculated by anyone if they do the download, take the download data. They can get those themselves. All we did was create differences between the subgroup rates on the fly. But yeah, we could, maybe more of a communications material or something could highlight some of the sex or gender differences between some of the metrics that we have too, which we haven't done all that much of.
And just actually as a follow-up question to that, this is for me. I am assuming, and tell me if this is correct or not, that the reason why our the data on our platform are categorized as male and female and non-binary is not included is just because that's a category that is not yet included in a lot of the data that we're seeing. Is that correct?
Saima, you can probably speak to that. I don't know how much there's been added documentation added, for example, to the NVSS, but yeah, there's small numbers and largely absent that classification, unfortunately.
So we're getting a lot of very positive comments in the chat, thanking you for the information, and yeah, really appreciate the tour through the platform, and would certainly welcome you all to send us any comments that you have. There's a survey that pops up, as Amy and Saima mentioned, when you visit the platform, and it's a ready way to leave suggestions about what you would like to see in the future, or any comments that you might have about the usability of the platform and how to make improvements. I know we've had a number of questions, as we always do, about slides and recording, and we will certainly send those out. It won't be immediately after the webinar, but it will be very soon after. And yeah, thank you all for being here. And we will up here on our screen is information about how you can get to the platform, and also how you can follow Drexel's Urban Health Collaborative and the Big Cities Health Coalition. Thank you very much for attending. I'll talk to you soon.